Williams, thank you for coming here today for your post-hospital follow-up visit. I'm going to review your hospital admission details and our conversation. So far, I know that you said last week you went to hospital for some chest pain and the heart doctor diagnosed you with high blood pressure and heart vessel contraction or spasms, which is also known as Prince metal or variant angina. For that situation, one blood pressure as well as heart medicine has started for you, which called amlodipine. You might not fully know the medication yet, and I heard you have some questions about the medicine. Let me go over through the medication for you, and please let me know if you have any question. First, I would like to discuss the effects of the drugs and how the medicine works within the body. In your case, Prince metal angina, heart vessel contractions are causing your pain versus a blockage or heart attack. Amlodipine, which belongs to the group of drugs called calcium channel blockers, that usually works by stopping the transfer of tiny messengers across the lining of the heart cells and heart muscle cells, and that's how it reduces the ability for the heart muscle to contract or spasm and cause you pain. The purpose of this medicine is to help stop the contractions and increase the oxygen supply to your heart, which otherwise would cause you pain. Additionally, amlodipine will help to control your blood pressure by dilation or widening of the blood vessels. Widening of the blood vessels allows a larger amount of blood flow, making less pressure on the walls of the blood vessels, which decreases the blood pressure. If you have any question, please let me know. The medication should start working 24 to 96 hours after taking it. Amlodipine works for about 24 hours to control blood pressure. And precisely 64 to 90% of the medication is absorbed by the body. After you take it, amlodipine is dissolved in your body's fat, become inactive metabolites through the action of liver, and is eliminated from the body through the urine. So you have to make sure that your kidney function is okay, because if the kidney function is not okay, then the medicine is not getting out of the body, which might cause toxicity and also the adverse effects of the amlodipine, which I'm going to describe to you. Also, you need to know about the half-life of the medicine, which is almost 30 to 50 hours. So please take your medication as per prescription to get the better effect. Do you have any question, Mr. Williams? As you may know, the majority of the medications come with potential side effects or adverse reactions. The most common adverse reaction of this medication is swelling or edema, especially of the ankles or feet. Other adverse reactions of this medication include headache, tiredness, heart palpitations or fluttering sensation, dizziness, nausea, belly pain, itching, skin rash, muscle cramping, and decreased sexual urges. These reactions are not very common, usually affecting 1 to 10% of people who use that medicine, but it is important to recognize any of these issues with taking this medication and to report them to your heart doctor. Mr. Williams, can you please recall some of the side effects to report to your doctor? An overdose of amlodipine could result in high degree of peripheral vasodilation with the possibility of severe heart palpitation or reflex tachycardia. Significant and prolonged hypotension, which might lead to shock or other fatal effect, So please be aware of taking proper doses of this medication. Pediatric consideration. This medication is also used in children to control high blood pressure and chest pain. Obviously, you're not a child. However, for comparative purposes, amlodipine is taken in the same way and can cause the same side effects. For elderly population who are older than 65, taking this medicine, we would have to know their kidney and liver functions, which I was talking about earlier, by monitoring some blood work. In the other word, a person with liver disease may not clear this medication as quickly as someone without liver disease. So it is removed slower from the body. If the drug builds up in the body, the person keeps too much medicine in their system, creating a toxicity. Additionally, since the elderly are often prescribed more medications for other health problems, we would need to make sure that amlodipine can go with their current medicines and will not cause an interaction such as an increase or decrease in one or more of their medications from working. I understand we reviewed a lot of information about amlodipine. What other questions may I answer for you, Mr. Williams? Thank you again for the comprehensive assessment and to go through about the medicine with you. Please let me know if you have any question and call the office if you want to come for follow-up schedule visit. Thank you.